In this session, we're looking to decrease soft tissue tension like muscle tissue tension and connective tissue tension like fascial tissue. We're looking to push around some fluid and increase recovery rates and decrease sympathetic nervous system and just leave you feeling good. We're going to start off by getting through the thoracic spine, so you can grab your roller and we'll come back down to the mid upper back. Just ease into things here. Hands behind the head. Sinking back over the roller. I'm starting just below. We don't want to get in right into the low back. We want to get into that mid, low, between the mid lower and the upper back. Not the low, but the mid low. You know what I mean? Interlock the fingers, and then we're looking to get some extension over the roller. You can start in with some breathing, feet flat on the floor, hips on the floor, and sinking back over the roller. We're looking to work in 1-2-inch segments, so you can work in place here for a little bit, keeping a little bit of tension in abdominals to support yourself here. And then when you are ready to move, just press into the feet to lift the hips, and then you can roll yourself down or up to move the roller where you need to, just kind of moving in that inch or so segment and then getting back into some extension here. Let the cares of the world whisk away like dust in the wind. Just pay attention to yourself and come down from the week. Breathing. We're working through the muscles of the erectors of the back, but we're also looking to mobilize all the joints of the thoracic spine. We spend a lot of time seated or having gravity pulling on us into that flex position, so it's really great to mobilize the thoracic spine into extension. We're also opening, flaring the ribs here, so kind of working through that, which will help with overall mobility of the thoracic spine, working through the ribs and the actual vertebrae themselves. And then slowly working your way up, breathing, taking your time here. Spend time where you need to. So if you feel like there's a few segments of the vertebrae that are moving kind of blocky-ish, kind of together, work on those for a little bit. You might get some cracking and popping. That's okay. That's what we expect to find here as you get into some extension, especially after the day, or if you don't do this all the time. This is a great rolling section through the thoracic spine to do like every day. I do it almost every day. And then just working all the way up to that upper back. Once you get to where you're kind of underneath the scapula, things aren't moving as fluidly because the shoulder blades, the scapula, are kind of stopping things from moving independently, kind of restricting that a little bit. So that's okay, just get what you can here. You can also do some stretching into the neck while you're on here. That feels real nice. And then when you're ready, you can ease out of that. By all means, if this is feeling real good, just keep going, you know? And then you can catch up to us at a later date. I'm gonna grab my ball here. You can keep going with the roller. We're gonna get into glutes. So I'm gonna take this down. We're looking to get in just underneath that iliac crest, the hip bone here as it comes around your back. Between that, the underside of that, and the greater trochanter. So as the femur comes up, you'll feel that bone on the side, just below the hip. Everybody's placement is going to be slightly different as far as how much space you have between those there. Men tend to have higher hip bones, so we might have a little bit more space, but just work to that. We want to work in between those areas, in the meat of glutes and right up, bumping up against that greater trochanter there. So you can come in again, feet on the floor, wherever you need those to be. Whatever hip you're working through, that's the leg we want to do some movement. So, and also supporting the shoulders. So pressing down into the palms, opening up the shoulders a bit to stabilize the shoulders and support your upper body as you work. And then you can do some movement here. So some internal and external rotation and some extension and some flexion of the hip. So just searching around through glutes. You don't want to move too fast, so always moving slow when you're moving the ball around. Stay open to stopping anywhere and taking your time there as you need it. And then breathing. Take your time. Switch around. The more you kind of square your hips up to the ceiling, the more the ball is going to come towards your center line, and you're going to kind of bump into the sacrum there. Donk. Or if you roll your body down, the ball is going to roll up and you're going to come into the underside of that iliac crest, which is where glute max is attaching into. There's a lot of work to be done there. I really encourage you to work right up to where the bone attachment is of these muscles. That's where the goods are. Trust me. We're working through a lot of neuroreceptors, reflexive pathways to connect with our tissue, to decrease tension. And then we're also pushing fluid around, inter and extracellular fluid, moving out waste particles and old used blood and hopefully pulling back in new cells to support and clean things up, and new blood with some healthy nutrients in there for you. So great for recovery as well in that regard. And then keep working with some movement there. You can come right onto the side, working through the side of the hip. Any sports or anything that you're doing, gotta love sports. This is a big stabilizer, getting into that just above that greater trochanter. So if I roll my body up, I'd bump into the top of the greater trochanter. And right around the top and around the side of the back of it, you're going to get a lot of deep attachments of the deep glute rotators. And around the outside at the top, glute med and min, which are stabilizers of that lower leg and the knee, or the upper leg and the knee, and the lower leg. And then you can do some movement here, some reaching, or pulling the foot back. Whenever you are doing movements of the leg, just take your time, move slow. Use your intuition, supporting the shoulder as I, reminding myself, letting that go a bit. Take as much time as you need there. You might find that one is different than the other and might need a little bit more care. I'm going to come into my other glute here. Support the shoulders. Open up the chest a bit. A bit of movement. And just listen to that. Do what you need. And explore. No movement is, not allowed. Explore your own body, work where you need to. Just the fundamentals are move slowly, listen, take your time. And as long as you're listening, you can't really do much wrong. Just use your body weight and you'll be fine. No need to put extra pressure in there. Breathing. Here I'm just, kind of have my pinky toe down and I'm just pivoting, reaching the heel and then pulling the heel back up. And that's enough flexion and extension of the hip to really get things going in there. Working around the outside just above the greater trochanter, between there and that iliac crest. Or find yourself, a little bit more towards the sacrum there at max attachment. Breathing. Come all the way over. Just even taking the time to quiet yourself, listen, and attempt to do some self-care for yourself is amazing. A lot of us don't make enough time to take care of ourselves. Life's so busy right now, and has been for a long time. It doesn't seem like a simple life anymore for a lot of people. A lot of external stressors in our lives, whether we bring those on or ourselves, or they're kind of imposed upon us with our job and whatnot. So good to take some time to come down, reel things back in a bit, take control of that nervous system. Excellent. From there, we're going to come into our quads. So we're going to work right from the top of the kneecap, the top of the patella, all the way up to that ASIS, the anterior superior iliac crest, that little pointy bit in the front of the hip here as the iliac crest comes around, and everywhere in between. You can use the ball, you can use the roller, you can use a combination of the two. Do what feels right. I like to use the roller first, just to do a general roll, and then I can come back after and be more specific with the orb. But let's start however you want. I'm going to start up at the hips, but you can start down by the knees if you want. The thing we want to look for here is support of the upper body. We have a mini plank here from the roller up to our shoulders. So we want to honor that and support that a bit. A little tuck of the pelvis, a little engaging the abdominals, anchoring the ribs down towards the front of the hips and pressing into the shoulders and anchoring them back. Just very gently. You don't have to stress out about pressing and really engaging, but just gently supporting yourself there. And then at the top of the hip, I usually do one leg at a time here. So I'm just getting into my right hip, and then I'm just supporting down here with my other leg. get through that attachment of rectus femoris, the front, the centermost quad muscle. And then right from there, I'll come in to check with the other one at the top. And then as I get a little bit lower, and anytime you need to, you can always use your hand to adjust the roller, its placement. And I'll get into both legs at the same time here. Do some rotation of the hips, and along with that, rotation of the legs to get into the inside and the outside of each leg. As you get into the inside, more inside of the leg, you'll be getting into a little more of the adductors, the groin muscles. And into the outside, you'll be coming around into vastus lateralis, and which is another quad muscle, as it attaches into the outside of the kneecap, the top, and then the IT band, of course, on the outside, which can be spicy for sure. And spend time in all areas. You want to cover the whole area from the innermost quad muscle, vastus medialis, in the inside here, to the outside here, vastus lateralis, coming down to the kneecap. And then you can come all the way onto the outside here, just like this as well, to work into IT band. Just follow the tension. Essentially, you're following discomfort. That's the nervous system telling you that there's tension there. There's something there. So listen to that and just, slow down. Work through it. Sometimes the only way out is through. So take your time. Breathing. And then work all the way down to the kneecap as well, the patella. All the way from right in the center at the top of it to the outside corners. Breathing, supporting that torso, a little tuck here and anchoring the shoulders. And then you can always grab the ball and, do some fine tuning in some areas where you really noticed it. Whether that's the inside of the knee, getting up more into the groin, or the outside. Breathe. Don't rush. We're looking for results. We're not looking just to get through it. We're looking to get into all the areas of tension. We're looking to come up off of the ball, feeling better, feeling that release, feeling that fluid flow back into the area. That's kind of what I find most impactful is as you release this tension in the tissue, the fascial tissue and the muscle tissue, as you come up off of the ball, you release that pressure. I feel, especially where I really need it, fluid being able to flow back in. Tension causes resistance to fluid flow throughout our tissues, our cells, arteries, the capillaries. So relieving this muscle tissue tension and connective tissue fascial tension will allow for fluid to flow in, and that can be really impactful sometimes. We're going to get into our forearms. So what I like to do with my forearms is I'll take my roller. You can have if you have a smaller roller, then you don't kind of have to straddle it here like this. It'll just kind of be out in front of you. But I'm going to have my forearm anterior side, like the underside, facing up to me. And then just on an angle to the roller. That'll just increase our surface area instead of going perfectly perpendicular to it. Perfectly perpendicular. And then what we want to do is we want to sandwich our arm and the roller with our other elbow. Here we want to work out in the end of the elbow. You don't want to work out here. That's going to put a lot of pressure on triceps as you're trying to apply pressure there. Get right into the elbow. Anchor the shoulders and press. So here, my working elbow, I'm pressing the shoulder down, depressing it, protracting it. And then that's all I need. I have kind of a little bit of pressure down and away. So I'm creating this shear force. And then you can just do little rolls. And here I'll work the tissue underneath with movement instead of doing our rolling that we would normally do. So here, coming into full flexion, shortening those muscles underneath, and then lengthening, extending in the fingers and the wrist, opening things up. If you've never done this, this is where you can really feel that fluid flowing back in. Really shearing on this, making sure you're always over top of the roller. You don't want to be out here, right? You're not supported then. But yeah, you can come off. I've had people come off the table when I was working as a massage therapist with them, and they were like feeling blood flow into their hand for the first time in months, years, who knows. People playing guitar, if you work with your hands all day. We use our hands so much, and all the muscles creating grip, most of them are up in the forearm, not in the hands themselves. And then just keep moving down the forearm, getting all the way out. This would be great for like carpal tunnel, any wrist stuff going on, wrist sprains, strains, breaks as well. Wrist mobility is really affected with breakages of the small bones of the wrist, or the distal, the end of the bones of the forearm, the radius and the ulna. You might get some cracking and popping in the wrist if you've never done this stuff, for sure. Working all the way out. Oh man. And you can just do light pressure here, no worries. Another thing you could do is pronation and supination of the forearm. You won't actually do those. You'll feel yourself kind of pressing into the elbow, right, as you do that. What we're doing here is we're stressing that movement and the interosseous membrane, this connective tissue membrane between the radius and the ulna. Feel that, open things up, shake it out a bit. Test out your new forearm, and then we'll check in with the other one. Yeah, we have two. Check it out. You might find, especially with our hands, obviously we have a dominant hand. Lefties are a little luckier. Oftentimes they're a little bit more ambidextrous. I definitely encourage you to challenge yourself to do anything with your left hand as well. If anything, it's a great mind exercise. But do check in with your opposite side. You might feel like you need to do more work on your dominant side, depending on what you do for work or the stuff that you enjoy. If you like racket sports and you're not even holding a racket on the other side. So spend the time where you need to, is the gist of it. And then some flexion and extension here. Pressing the shoulders, support and anchoring down. We want to feel lats anchoring here as we press in. And then slowly moving out. You can move that arm and you can kind of shear away so you can feel this pulling of the tissue here. Breathing. When you get good, you can kind of roll and adjust as you shear, running a line across, always staying over the roller as you go. Moving that hand as you work. Those are lines that I would kind of run as a RMT when I was in the business. And you can too. You could do some pronation, supination, especially up here when you're at the head of the radius up here. That's where a lot of that rotation's coming in, whether it's supination with the muscle supinator or pronation with, what is it? Pronator teres? But there's muscles specifically for that pronation and supination. One would be right here, pronator across the front, and supinator here. And then take your time getting down all the way just to above the wrist. I like to kind of work to just above the wrist here when you're doing your own stuff. Opening up. And then you're also working through the back, right? At the same time you're working with those muscles, you can come around into pronation and work through the back. That is a little bit more challenging to catch that tissue there, because I kind of have to come over top and hook back towards me. And then when you're ready, you can come out and give things a shake out. Maybe some wrist circles, keeping the forearms in position and taking your wrist through circumduction. Crackly and poppily. There you go, and awesome work. Thanks for joining me. Take care of yourself. Take the time that you need now. Chilling out, grab some water, take care of yourself, and then we'll see you in the next one.